I'm David Soglin. I'm a pediatrician. I've been with Cook County for 20 years. I've been department chair for the last 13.
I'm Audrey Soglin. I'm the executive director of the Illinois Education Association, and I taught for 25 years.
Audrey's my sister. We were at a barbecue at Audrey's house, and I was talking to her about toxic stress and adverse childhood experiences.
I was just intrigued by the fact that there was actual science that backed up what so many teachers know.
And it dawned on us after many, many years that pediatricians and teachers together could be good advocates on behalf of children. ACEs are adverse childhood experiences, a parent's death, divorce, witnessing domestic violence, being physically or sexually abused, being neglected, living in a household with alcohol or drug problems, witnessing violence in your community.
It crosses income levels, it crosses races, genders, it is universal.
And we know that people who experience more ACEs are more likely to have depression, more likely to be substance users and abusers, more likely to have heart disease, hypertension, and they're more likely to have strokes. People use 4 different experiences as the cutoff between high risk and low risk, but we know that even in those high risk kids, we can help mitigate the impact of the ACEs. We are evolved to respond to stress with that fight or flight response. You know, if you're going to be attacked by a bear, you want a big stress response so that you can run away or fight. The problem is that when children experience chronic stress, it reduces the number of connections in the brain, reduces the impact of the frontal cortex, which is where the executive function, decision-making, self-control comes from, and increases the connections to the emotional centers of the brain. And you're less able to stop yourself from whatever that first reaction is and behave in the way that your teacher would like you to behave.
When we first started this work, we identified some partners. The Illinois chapter of the American Academy of Pediatrics, Governor State University, and the Consortium for Educational Change. And what CEC brings is an approach to problem solving in districts that bring the teachers and their union as key partners.
If you're from the Chicago area, you probably have a stereotype of the southern suburbs as an area that's had a lot of disinvestment, a lot of crime, a lot of industrial flight.
Tom Lenz went out to the districts and he interviewed 39 people, and that's how we got these 3 task forces.
It was out of those conversations that Tom, the organizer, had with leaders in each of the 3 districts. They were able to identify what it is that people were concerned about, and there were some themes.
Primary care and wellness, trauma and behavioral health, and parent engagement.
The Academy of Pediatrics was very interested in getting involved in this project because we believe that when we are looking at issues related to toxic stress and trauma, that there are things that we can do to mitigate those circumstances.
I was talking with a pediatrician a few months ago, and they recently got a food pantry in the basement of the clinic. Until they had that food pantry, he never asked a family if they were hungry, because if they said yes, what was he going to do? Say, oh, I'm sorry to hear that. So he never asked. But as soon as they had the food pantry, he asked every family if they had hunger issues. And something like half of his patients did. So once you've got a solution to a problem, then you can start looking for that problem. We should be thinking about ACEs because there's things that we can do for them.
Teachers are very receptive. There's almost, in some ways, like a relief. Oh. I see these kids in my classroom. I'm dealing with these issues.
Something clicks for them. They've moved from the idea of some children don't have self-control or they're not well disciplined to maybe there's something else that's going on.
We're purposefully not calling it mental health because that implies a need for medication or a need for a psychiatrist. We're talking about behavioral and trauma health.
There's so many times when teachers have to, figure it out right there in the moment.
And often feeling like they haven't, and just the tremendous sense of failure and loss that involves. So that to be involved in something they think can make a difference is tremendously energizing for our teachers.
We're saying you don't have to do this by yourself. We'll give you some training so that when these incidents occur in the natural course of your day, you know how to respond. So the teachers are excited about this because they feel both validated about what they're seeing and that there's some support for them too.
If we as a parents are connected with the school system, if we understand teachers teaching in the classroom, we can help the whole community to grow.
We've got to find a way to help bridge the gap between the community and the families outside the school with the work we're trying to do with kids inside the school.
That would all come with
Our teachers would be thrilled if every school had a parent education program that helped the parents deal with both their own issues and their kids' issues.
You invite the parents into the school or some setting. You provide babysitting so that they can actually be present while they're there. And then you start group discussions about parenting.
And I say yes because I was worried about my son.
One of the things we've learned from the science and the literature that's out there is that there's no age at which it's pointless anymore. Every interaction we have with the child is an opportunity to give them a positive experience and to reduce the impact of whatever ACEs they've experienced.
We're really seeing this long term. All the steering committee members, we're looking to see how we can work with the districts to foster sustainability, but also see if we can procure additional funding.
I think we have a huge opportunity to impact education. We know we have an opportunity to impact adult health, and I can't help but believe we have a huge opportunity to impact the juvenile justice system and probably the adult system as well.
And once we look at the results, once we know it works, once we can together craft some proposals, then we do intend to try to influence policy.